Hello, cruel world. My name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Shahominous. This episode that you're watching right here of A Psych for Sore Minds will dispel 5 myths about bipolar affective disorder. I'm also going to explain exactly what it is and what it isn't. I'm going to disclose a list of some celebrities with bipolar affective disorder. Plus, at the end, I'm going to tell you about an actual real-life criminal case that I've assessed as a forensic psychiatrist. So I give evidence in criminal trials for people that have mental illnesses and can be violent. And I believe this individual committed criminal acts directly because of his symptoms of bipolar affective disorder. So I will tell you about the evidence that I gave. Ultimately, I had to decide, did he have a mental illness? Should he go to hospital or should he go to prison? All of that coming up in this episode. Give you a bit of an insight of working behind the scenes as a forensic psychiatrist, because my intention to make these videos is to educate you, get you thinking like a forensic psychiatrist, also to take over the world. Anyway, enough foreplay, let's get into the myths. Okay, you nerds, before we get into the first myth, I'm going to give you a few statistics about bipolar affective disorder, which used to be called manic depression. I'm going to break down exactly in layman terms what it is during the first myth. Okay, so some statistics. Globally, an estimated 46 million people have bipolar affective disorder. It's the 4th most common mental health problem worldwide. So I've got a question for you, which I will answer at the end of this episode. Let's see how sharp you are, my Psych for Sore guys and gals. The question is, what is the prevalence of bipolar in the UK? And what is the proportion of people that have it in the UK? And here's a clue. Compared to other conditions, it's one of the most common long-term conditions. Nearly as widespread as cancer, considerably more prevalent than dementia, epilepsy, or autism. So the point I'm trying to make is it is a very common and serious problem. It can develop at any age, but it tends to be when people are a bit younger. The average age is about 25. The other final thing I'd say is that it has a huge impact on the word that rhymes with truicide. I'm not going to say it here, but taking your own kind of life. People with bipolar have a significantly increased risk of that, around 20 times higher than the general population. So as you can see, in some cases, it can actually be very, very threatening and damaging. And bipolar affects roughly the same amount of men as it does women. Okay, enough foreplay. Let's get started with the myths. The number one myth about bipolar affective disorder is that it is the same thing as mood swings. This myth really gets my donkey, okay? Mood swings are not synonymous with bipolar affective disorder. Even saying that phrase out loud annoys me, although I did get to use my favorite word, synonymous. Mood fluctuations, mood swings, are a normal part of life, whereas bipolar disorder is characterized by extreme mood episodes, either mania, being up, or depression, meaning down, or somewhere in between. Euthymia, as in stay euthymic, and they last for extended periods, days, weeks, sometimes even months, and they significantly disrupt daily life. So, what is depression? Might sound obvious, but it's more than just temporary low mood, such as when your neighbour's dog has shat on your roses again, or people are not subscribing to your YouTube channel despite having uploaded almost 1,000 videos. So it's not just low mood, it's also things like a lack of energy, a lack of motivation, decreased pleasure in your previous kind of hobbies or activities. There's a specific name for that, decreased pleasure, because we psychiatrists like to sound clever than we actually are. So Psych for Sore guys, I've got another question. What is the name for that? I will tell you later on in this episode. Okay, so that's depression. Then we've got mania, which is kind of the opposite of that. So when somebody's suffering from mania, they're energetic, they're speeded up, they have like what we call a flight of ideas, all these sort of great ideas coming in. They lack the need for sleep. They feel euphoric, so they feel really happy. Clap along if you feel like a room without a roof. So I know you're probably thinking, these symptoms actually sound quite fun, and it can actually be quite enjoyable to be in a state of mania. But there are downsides. So people who have mania can be quite impulsive and can be quite disinhibited. So disinhibited means when you do things that's not your usual characteristics, and then later they can regret their actions, such as spending money recklessly, maybe gambling, buying things they don't need or they can't afford, being sexually promiscuous. It's not the same as being drunk, but I often compare it to being drunk because there's an overlap in that it's the same experience of being in a different state and being like really impulsive. But at the time, even though you might know that you're drunk, you're quite invested in your thoughts and your feelings at the time. So at the time you don't care, even though you later regret it. And yes, I am talking about what you did at your last Christmas party where you had carnal relationships with that hairy intern from account, and then you had to awkwardly bump into him in the corridor every day for the next week. When we're talking about mania, there's an extreme version of this which is associated with grandiose delusions. Grandiose delusions. I actually invented that term. So I'll give you some examples. Grandiose delusions, when you believe something that's untrue that indicates that you're somehow special or you have special powers. A belief that you can kill somebody and then resurrect them later, which for obvious reasons can be extremely dangerous. You have special abilities such as predicting the future or reading minds, that you're related to Jesus. Another grandiose delusion might be that your blood contains a cure for COVID, or that you're charismatic and you use your clinical psychiatric knowledge to become some sort of super famous YouTuber. So all of those things that I mentioned are not theoretical, they're actual delusions that I've seen in my own patients. Apart from the last one, that was a friend of mine. Hypermania, not to be confused with hippomania, which is a theme park for aquatic mammals that I'm developing and I intend to pitch on Dragon's Den one day. Hypermania is all those things that I said about mania, but kind of watered down a little bit. So it's like diet mania. So you have those kind of symptoms, speeded up, feeling happy, but it doesn't affect your functioning. So you're still able to hold down, a job, relationship, as opposed to mania, which is right up there, where you're just too speeded up and disinhibited and elated to actually go through day-to-day activities. So that was a bit long-winded, but to summarize, what I'm trying to say is that bipolar affective disorder is not mood swings. So this is mood swings, and this is bipolar affective disorder. It's periods of depression, mania, and euthymia, and mood swings rarely affect day-to-day functioning. Okay, moving on. Myth number 2 about people with bipolar affective disorder is that if you have this diagnosis, you cannot be successful. There are many people with this disorder who manage successful careers with proper self-management strategies, proper treatment. So it doesn't have to be a barrier for professional success. I know what you're thinking, we don't believe you, Dr. Das. Give me some actual well-known examples that I would have heard of. All right, chill out. Okay, I will. So there is Mariah Carey. So the iconic singer-songwriter has spoken openly about her struggles with bipolar disorder and the importance of treatment. Me and Mariah go back like babies and pacifiers. Number 2 on my list of celebrities with bipolar affective disorder is Jean-Claude Van Damme. The Belgian martial arts action star has managed his bipolar through therapy, through medication. I can't change the laws of physics, but I can bend them. Time Cop, 1994. My third example of a celebrity with bipolar, you're going to know this one, of course it is. What? Yeah. Kanye West. The rapper, the icon, fashion designer, he's openly discussed his struggles with bipolar disorder, although some aspects of these discussions have actually been controversial, but I suppose that's Kanye in a nutshell. You ain't got the answers, Sway. You ain't got the answers. I am Shakespeare in the flesh. Actually, on a separate note, I've got this detailed video about Kanye West exploring some of the crazy things that he said and trying to explain why. So basically, I argue that it is part of it is his celebrity, being surrounded by yes men. Part of it is his naturally very narcissistic personality, and on top of that, part of it is bipolar affective disorder. I think there's loads of different factors. Go chickadee, check out my video. Always be plugging. 18 years, and on your 18th birthday you found out it wasn't his? Okay, my fourth and final celebrity that has openly discussed having bipolar disorder who is successful is Mel Gibson. So the actor and director has acknowledged his diagnosis, and he's also spoken about the role that treatment has played in his life. They may take our lives, but they'll never fake our accents. Okay, moving on. Myth number 3 about bipolar affective disorder is that it's caused by alcohol or drugs. Now, I suppose one way of looking at it is that people with bipolar might feel more like drinking to drown their sorrows when they're depressed. You know, like, oh no, my neighbour's dog shat on those roses again, I need a baby shower. Or equally, if they're already disinhibited with a manic episode, feeling speeded up, they might be elated and they might be in the mood for party. So they might want to take substances, for example. And whereas substance use can worsen the symptoms of bipolar disorder, for example, marching powder can increase your mood, and obviously you'll come down the next day and you'll feel depressed, and it can make somebody more disinhibited and impulsive. And this can actually, increased drug use can lead to a vicious cycle. But in these situations, what I'm talking about is substance use exacerbating the symptoms of bipolar affective disorder. It is not actually the cause of it in the first place. Okay, myth number 4. Come on, you can do it, get your back into it. I can do it, get my ass into it. Myth number 4 about bipolar affective disorder is that people with bipolar disorder lack insight. So many people with bipolar disorder experience significant self-awareness about their moods and their symptoms, so they can have insight. So I've actually had more than one patient say to me that when they're in this state, especially when they're in a state of mania, it's like being a bit drunk and wanting a kebab. So at the time they know it's a bad idea, but they just don't care, because at the time they just want that meaty tenderness and that massive chunk of onion. So having drunken kebab is a bit like if you replace alcohol intoxication with mania and replace kebab with investing all your money into fidget spinners and then sleeping with your hairy intern again, even more awkward the next day. So my clinical advice, if you do have something like bipolar and it's hard for you to control your behaviours or recognise that you're in these periods, is trust somebody when you're choose somebody who you trust when you're well, when you're euthymic, when your mood is normal. So it could be, partner, family, friend, and just ask them to explain to you when your mood is getting elated or when it's getting low, and just trusting them. So even if you don't feel it, even if you feel at the time that they're being a party pooper, remember that you gave them permission to critique you and your behaviour when you were well, and therefore even if you're not necessarily feeling it, agreeing with it, you've already made that mental connection that you have to listen to them, to go to see the doctors, take medication, etc., etc. So that can play an active role in managing the condition and recognising early warning signs of mood swings. Okay, before we get into the final myth, I'm just going to quickly promote a couple of my own videos about bipolar affective disorder on my channel. Always be plugging. So I've actually got a video of my analysis of what Andrew Huberman said about bipolar affective disorder. He's been a naughty boy recently, hasn't he? And I've actually interviewed a lovely lady who suffered from severe bipolar affective disorder. It was quite an old interview. It was like 2-3 years ago, when life was a simpler time and I was so happy back then. And I talk about how it's affected her life going in and out of hospital, etc., etc. Okay, we're on the home stretch now. Myth number 5, my final myth about bipolar, is that it makes people violent. Before I get into that, I want to introduce you to a channel. This is a Schmike for Small Minds. I am a forensic psychiatrist, Dr. Shaham Das. I assess mentally disordered offenders in courts, in prisons, and psychiatric units. I give evidence in criminal trials. This video is a smorgasbord, this channel I should say, of videos related to mental illness and offending and the crossover between the two. Recently I've been doing these 5 myths debunked things. I've been talking about kidnapping, restraining orders, men's mental health. Go chiggity, check it out. I implore you to subscribe. Not only does it help me out immeasurably, but I guarantee that if you subscribe, you'll never get tomato ketchup stains in your pristine white work shirt ever again, guaranteed, or your money back. The myth that I was about to get into is that bipolar disorder makes people violent. And it is possible, and I've certainly seen some people be violent with this diagnosis, especially when they're in a state of mania, because it makes them sort of irritated and disinhibited. I keep using that word. And I'm actually going to give you an example very soon about one of those cases. But I really want to make this point, is that in my experience, people with this disorder who become violent already had violent tendencies. So just like alcohol can make people who are naturally aggressive and lack empathy violent, but it doesn't make everybody violent, right? Your old Auntie Edith doesn't start swinging after she's had a sherry. So mania, again, disinhibits and it basically uncovers underlying tendencies. So it doesn't make people violent if they're not inherently violent anyway. But as I said, it can increase the risk of irritability and impulsivity in those people who are violent. I'm kind of aware that I'm making a lot of comparisons between bipolar affective disorder and alcohol. Obviously, I'm not saying they're the same thing, they're not the same thing. But the reason I keep making the comparison is because alcohol obviously is something that everyone can relate to, or most people can relate to, but also the disinhibited thing is there's a huge overlap in that one particular bit. So drinking alcohol makes you disinhibited, makes you think things that your sober self would never do. They make them think they're a good idea. So mania is similar to that. Okay, so I asked you a question before, my Psych for sore guys and gals, don't cancel me, which was the prevalence of bipolar affective disorder in the UK. It's about, what's that? Yeah, correct, 1.3 million people in the UK. So that's roughly 1 in 50 people, so 2%. It's quite a lot, I think you'd agree. Okay, moving on, I'm going to tell you about a real life case that I have seen of a defendant who's got this diagnosis. I've changed a couple of demographic details. I've anonymized the patient to respect the doctor-patient confidentiality clause, but the essence of what I'm saying is 100% true. And I want to make the point the vast majority of patients with mental illnesses, including bipolar, are not violent, as I've just said. But because I'm a forensic psychiatrist, that's the ones that I'm asked to assess, those that have mental illnesses that have committed offences. So I'm going to change this guy's name and call him Mr. Hover. And I saw him in court. He was actually been in prison on remand, but he came over to court for a hearing and for my assessment. And he'd been remanded for 2 offences. One was assault by beating of an emergency worker, and one was breach of a restraining order. So he's arrested by police officers at his home address, his family home address, where he wasn't permitted to go because of a restraining order. When the police turned up, he became very verbally aggressive. He was shouting and swearing at the officers, shouting at his ex-wife. The officers moved in and they put handcuffs on him, and he actively kind of resisted, including fighting, kicking, screaming, kicking out with his legs. So it wasn't a very serious assault. I think he didn't break any bones, but he just sort of bruised a couple of police officers, literally and in terms of their ego. So I saw him in a locked cell in court. He'd been aggressive during that morning, and he'd spat at some of the court workers. So I saw him in the one room in the cells in court that has like a glass partition. So right from the beginning of the interview, Mr. Hover was aroused, he was excitable, he was kind of speaking very quickly, he was rambling, he was speaking over me, and he seemed to be generally quite agitated and irritable and angry, but he didn't seem angry at me. In fact, he seemed kind of indifferent to me. He almost wasn't like I wasn't there. He was just going off on these rambling tangents. He led the conversation, and I had to sort of interrupt him to get his thought process back to the question I'd asked. And then, I kid you not, he started randomly meditating in the middle of our assessment, and then did some press-ups as well. And on several of occasions, Mr. Hover went on these tangents, at times in a jumbled order that didn't make sense. He seemed to be really preoccupied with a number of social issues, such as knife crime and school shootings in America. But what he said wasn't making sense to the conversation. So I'd ask him about the offence of the restraining order, but he'd talk about knife crime. So he was jumping between topics, which in psychiatry we call formal thought disorder. So it's the form of our thoughts, the connection of our thoughts are sort of discombobulated. Also a great word. So when I asked him about his offence, when he finally talked about it, Mr. Hover refused to accept that he'd broken the law. He believed he was not guilty of the allegations against the police. He believed he was protecting himself. He shouted, and the one time he got angry at me, he shouted, "It's my house and it's my children," really loudly at me. So to gently sort of test his beliefs, I proposed that regardless of whether it's his house, he would be breaking the law if he breached a restraining order. However, he believed that the restraining order itself is invalid because he said that he had the blood of a king. So then I asked him some more questions about fitness to plead. So that's the ability, this is a very common bread and butter kind of thing for a forensic psychiatrist, in case you're interested. The fitness to plead is your ability to actually go through the trial process. So can you understand the evidence? Can you put in a plea of guilty or not guilty? And it's something that if somebody has a mental illness and they're unable to do that, then they shouldn't be found fit to plead, because it's unfair to try somebody to put them through a criminal trial if they literally don't have the cognitive ability to go in it. And he didn't believe that the trial was even necessary, because he believed he'd be exonerated because he had a special relationship with the judge, and again because he had the blood of a king. And he also made some really other odd comments. So when I asked him about the evidence in the trial, he believed he could erase the CCTV footage with his thoughts. So grandiose delusions. So hopefully it's obvious to all of you, I'm talking about these grandiose, these delusional beliefs that are driven by mania. So just to make a really clear distinction, it's not that Mr. Homer didn't care about the restraining order and intentionally breached it, which lots of, criminals, antisocial people might do and be in control of their actions. He was unable to actually understand the concept of the restraining order because of his delusions and other things that I've mentioned, being disinhibited, excitable, distractible, speeded up, flight of ideas, elated. All of those things confirmed to me that he had a diagnosis, bipolar affective disorder, and was right in the middle of an acute manic episode. I hope that's obvious to you as well. So, what's the point of all this story? So I recommended to the court that Mr. Hover was unfit to plead and he needed to be transferred to a psychiatric hospital for treatment with mood stabilizers like lithium, not to prison. By the way, if you're interested, I've got a video, 5 myths about restraining orders. Why is people blocking? Some things about them which you might not know. Okay, we're about to finish. I asked you a question, which is, what do you call a decrease in pleasure in activities? It is, of course, sorry, say again? Louder, speak up. Anhedonia, that's what it's called. Right, to summarise, what have we learnt, kids? We've learnt that bipolar affective disorder is not synonymous with mood swings. People with this diagnosis can lead successful lives. Your neighbour's dog shat on your roses again, and that alcohol and drugs do not cause bipolar affective disorder, although they can exacerbate symptoms that are already there. That's enough of me rambling. Have a blessed day, stay euthymic, buy my goddamn book, and do not forget, I love you.